Namaskaram, the South Indian is here. Yes, it's the festive season. We all kind of spreading good cheer and we all going to enjoy ourselves. But let's not forget that there is also something we need to be extremely careful about, and that is the surge of COVID. So first up, let's take stock of the COVID cases across the country. You know what? When it comes to an epidemic, then this South Indian becomes pan-Indian. So let's begin. COVID cases were detected in the National Capital Region or the NCR region. 3 people tested positive in Ghaziabad, while Noida clocked its first case. Health officials collected samples from close family members and contacts of the index cases in all these regions. The person who contracted COVID in Noida apparently has a travel history to Nepal and has been kept under home isolation. But let me add here that people who have been infected with COVID in these regions have mild fever and cough. Insofar as the new subvariant of COVID, that is JN1, is concerned, a total of 21 cases have been detected so far in the country. Goa is right at the top with 19 and other states 1 with each, which includes Kerala and Punjab, Rajasthan as well. Union Health Minister Mansukh Mandaviya is continuously reviewing the COVID-19 preparedness, readiness in the country and stressed on the need to be extremely alert amid the spike in cases. Earlier this week, the ministry issued an advisory asking the states and union territories to maintain a constant vigil on the situation, besides ensuring adequate testing and sending positive samples for genome sequencing. Let's talk about the South. Karnataka witnessed a doubling of number of cases since Wednesday, with 1 COVID-related death as well. But then so far there haven't been any JN.1 case, is what the state is saying. Chief Minister of Karnataka Siddaramaiah held a meeting with the COVID-19 Technical Advisory Committee and reviewed the preparations to tackle COVID in the state. He also announced the formation of a cabinet subcommittee to coordinate with experts in order to implement their suggestions to contain the virus.
We had a discussion with the Union Health Minister and all other ministers, and basically they have asked us to continue our preparation, keep vigil, increase our testing, and ensure that all oxygen and beds and ventilators and all that is all in place. And any major outbreak, the government should be prepared to handle it. But they are saying this variant has been, the JN.1 variant, has been around for almost a few months now across the world. And there's no need to panic. It's a subvariant of the Omicron. So just keep testing more. Karnataka is now the highest in India in number of tests in the last 24 hours. So we have a target of increasing it to 5,000 by Saturday. So do test more, find out more, and then later on we can see what else to do. It's no guidelines, no restrictions on movement, no restrictions on gatherings, all that. But we advise precautions for people. Our advisory is to take precautions for people when they are in crowded places. Better to wear a mask. And that advisory we have already given.
Closer to Karnataka, Maharashtra reported 11 new cases of COVID, raising the active cases to 53. 27 cases have been reported in Mumbai and 10 each in Palghar and Thane. The BMC meanwhile made a statement that it was fully aware of all the preparations, especially when it comes to the new JN.1 virus. Now, there are 2 different things which are happening here, and I am making it very clear. One is COVID. One is the new subvariant, that is JN.1, right? So, there are cases in, there is a caseload which is already there in COVID, and there are new JN.1 virus case which Goa is topping right now. Let's now turn our focus to Kerala. So far as COVID is concerned, nearly 88% of the nation's COVID cases have been reported from Kerala. The number of active cases went up by 2,341 on Thursday, and 3 more deaths were reported. According to the Ministry of Health and Family Welfare, the total number of deaths in Kerala after the fresh COVID surge reached around 15. But you know what is very surprising? That is that even as we are speaking, you and I, there aren't any restrictions in place in Kerala. I know that you should not make comparisons, but I will compare it to the situation in neighbouring Karnataka, which has issued very strict guidelines for the elderly to mask up. My mother, who's 80 plus, lives in Bengaluru. She's been asked to mask up if she goes out, and they're all following it diligently. Also, temperature checks are back, and I know this. I called up schools in Bengaluru. In schools, all the children are being given thermometers so that they can check their temperature. So far as Kerala is concerned, I know hospital staff, people who are health workers, they of course wear a mask. If you go to hospital, you are wearing a mask. But apart from that, I don't think that there are any restrictions. One of the reasons for Kerala government not prescribing any restrictions against the rise in COVID cases, despite even public health experts are saying, let's be careful, because they are saying that the subvariant JN.1 spreads rapidly, and it is because, of the nature of the virus. One of the reasons, ladies and gentlemen, is because of the mass outreach program of the CPM government. This is an allegation called the Nava Kerala Sadas. Now, this is mass outreach, meaning, you go out, you attend public meetings. Let me equate it, it's not really a padayatra, but something, where you go and meet, you can be in vehicles. This was started nearly 2 months ago, and it is supposed to end on Saturday. But all along, that's what they are saying, because the CPM-led government, the Pinarayi-led government is doing this, therefore there are no restrictions in place. We'll have to wait and see if it comes after this gets over, this Nava Kerala Sadas. Also, let's not forget the Mandala Puja in Sabarimala is witnessing heavy traffic of devotees, and the local authorities are struggling and facing major challenges controlling the crowds.
You can see that the number of tests in the state is high when compared to other states, and naturally then we find more positive cases. But the ICU occupancy, the ventilator occupancy and the isolation bed occupancy, when you analyze the situation, there is no increase in ICU occupancy, ventilator occupancy or isolation bed occupancy. And the deaths occurred, they had severe comorbidities. Like one person had, he was severely ill with the cancer. He was hospitalized, and some other patients had CKD, chronic kidney disease, heart disease, etc.
Look, there is no doubt that Kerala came right on top when all of us faced the first surge of the pandemic as a state which became an example for the entire world. The way Kerala managed COVID became a case study. But then this time around, I am asking you, is Kerala taking it rather lightly? Let's find out. Let's talk to experts. This is what is my contention. Maybe I am wrong, maybe I am partially right, who knows. Let's debate. So, let me now introduce all the experts. Dr. Sasidharan, who is State Secretary of IMA Kerala, is here. Professor Dr. J. A. Jayalal, former National President IMA, is also here, and Dr. Sulfi Nuhu, former President IMA Kerala, is also here. A very warm welcome to all the doctors. So, Dr. Nuhu, I'll come to you, and then maybe Professor Dr. Jayalal, I'll come to you. Dr. Nuhu, I know that you will perhaps not talk politics, but you are a doctor. I have done lots of shows with you. You always call a spade a spade. I remember very well talking on several issues with you. Tell me something. Why are the restrictions not in place? Is it because of the mass outreach program, which is being led by Pinarayi Vijayan and the CPM?
Yeah, thank you so much, Sudha, for the nice words. Definitely, I'll talk science, only science. So this time, I think I'm going to disappoint you. I think, there is absolutely no necessity for any kind of restrictions at the moment in Kerala. You see, what happens is that there is a slight increase in total number of cases in Kerala, but there is no point in keeping some restrictions at the moment, because we have found out a subvariant of Omicron here, and a total number of cases, is not picking up very high. This is a season of some kind of respiratory tract infections, especially in November, December. We in all these years we used to get some increase in number of cases during this period. That is the first thing. The second thing is there are some COVID cases. There are some H1N1 cases, viral fever, dengue, and also this thing, leptospirosis, and common viral fever. All these things are here. There is no peak in COVID cases. And most importantly, these COVID cases. See, I'm an ENT surgeon sitting in right in the city, in the heart of the city, and I can see that there is not at all sudden increase in COVID cases. There are cases, but then it's very mild only. Most of them are asymptomatic or mildly symptomatic. There is no casualty. I mean, like intensive care unit admissions or any patients recurring. Even admissions are not required at the moment. So I think if you look at the data all over the world during all these seasons, whenever there is a sudden uptick of COVID cases, you can see that these uptick came back all of a sudden, maybe in few days or maybe in another week or so. And if you start implementing the restrictions all of a sudden, it will create a panic all over the state and probably in the country, and there is no necessity at all. We are absolutely sure that this small peak will come down maybe in another few days. That is what we expect, and that is science also.
Yeah, absolutely, and I so wish that that's true. But also, let me ask you before I go to Dr. Jayalal, is that the cases were found in Tirunandapuram and Kannur. Am I right? I mean, the JN.1, these two cases. Professor Jayalal, I want to ask you that, why is it then? First of all, prevention is better than cure, is what you doctors have taught us all our lives, right? Although a lot has been written about COVID, we are still figuring out. And I've spoken to doctors like Rajiv Jaydevan. That day he was on my show. He said, listen, I don't know. At one point he said, we do not know. We're still learning. I look at it from the prism of science, but it's mysterious. It keeps changing. It's like avatars, you keep changing. The point is, if you look at neighbouring Karnataka, like I said, masking up has become mandatory. I mean, you are being ticked off now by, volunteers. Very soon, maybe there will be marshals also. Children, their temperatures are being taken. Don't you think that Kerala, of course, there is a political reason which is being attributed, that if, the government decides to have a mass outreach program, then obviously, and also Sabrimala, if you see, your mind will boggle, Dr. Jayalal. 1 lakh people jostling, all men, all of them, there is absolutely, it looks like scary. Don't you think that there should be some restrictions in place, Doctor?
Yeah, I fully agree with you on the points which were raised on the need for the preventive step. Because the number is started increasing, the testing is becoming, the number of tests they have done, and the positive rate of the testing is 30%. That is a relatively huge number. That means a lot of people are not testing their when they have this cocktail of cough with fever and body pain. They are not testing. They think it is an influenza. They think it is a common cold, and they are not doing the testing adequately. So, number of samples tested, 30% of the samples are showing that it is positive, and 265 case rise is absolutely a large number, and we need to take some preventive measure. On the other hand, Kerala is a one state where there is a public health system is well developed. Even the interior or the remote areas of the Kerala, we have all the infrastructure, healthcare problems are there, and they are used up to such situation. They are the state which has reported on the Nipah. They are the state reported the first COVID, and the people are also more educated, so they know for themselves the masking and saying the restrictions are not only on the COVID or the pretext of the COVID, but in this era of this more number of influenza, cold and common cold is spreading, the masking is a better option. So I personally believe, and the the masking shall be advised, shall be instructed, or shall be even make mandatory for the people who are when they are coming to the common place or the common the mass gathering. Absolutely, there is no need to panic. It is only a variant of interest. It is not even a variant of concern.
Yeah, so I mean, but the restrictions are not in place. That's the truth, and it's good that you have thrown some light on it. Wait a minute, to both the doctors, please stay with us. I want to take a small break and I'm coming right back. Ladies and gentlemen, the South Indian is taking a very short break. You know, dive into the unparalleled financial wisdom with Money9, the ultimate app to decode finance and real-time pocket cash. Get a hold of your financial journey starting now, and the South Indian comes back in a jiffy. Stay with us.
जानना है तो देखिए, समझना है तो सुनिए, सीखना है तो पूछिए, और कमाना है तो खरीदिए। जानकारी, सलाह और निवेश सब एक ही सुपर ऐप पर। पैसे का सवाल है तो जवाब है Money9। आजादी पैसे की, अभी डाउनलोड करें।
Welcome back. We are talking about how Kerala, despite the cases, 88% of the country's cases are in that state, a state which actually became an example to the entire world about how to control the COVID pandemic when it actually broke, and even later Nipah. But the thing is that there are no restrictions in place, and one of the reasons it's being alleged that could be because of the mass outreach program which is being initiated by the Pinarayi-led government. I am joined by Professor Dr. Jayalal, former National President IMA, and Dr. Sulfi Nuhu, former President of IMA Kerala. Yeah, Professor Jayalal, you were saying, please continue.
Yeah, but what I mean to say is official restriction on people coming together and joining together at this moment is not required, not mandatory, and not possible also, because this is a festive season. Not only Sabrimala pilgrimage, the next week Christmas is going to start, New Year is going to start, most of the people are coming in, and Kerala is buzzing with the people traveling across. So at this moment, putting any restrictions on travel or any restriction on mass gathering is going to be a counterproductive, and it is not going to be yield any result. But on the other hand, educating the people and promoting them and empowering them to wear the mask and follow the etiquette of the COVID, and as far as possible keeping the distance is definitely, it is not for only for the COVID, but for the total health of the respiratory tract infection. It is a better aspect. And I do not agree on you that it can be a political reason, because it is not. It is only one sect, the political reason, because all the party involved with this in the Sabrimala, all the parties involved in the rally and the festive seasons are there. May not be it is the reason for the government not thinking that. Probably in their wisdom they thought the people themselves are aware, people are more promoting, more towards the upkeeping of the health, so they are self-educated to wear the mask, and that is the reason why the restrictions are not put. That is what I believe.
But Dr.
But
Jayalal,
as far as Indian Medical Association concerned, we will advise the people to wear masks and follow the
Dr. Jayalal, you are a doctor, I am a journalist. Let me tell you, when COVID broke, I saw many politicians doing rallies and it became an issue. I questioned all of them, whether it's Tamil Nadu, Stalin did it, whether it is Telangana, at that time K. Chandrasekhar Rao, everyone, and I said, what is this nonsense, people climbing over each other and doing this? You have security, what about that poor man? He will die tomorrow, you will go home. So this is about us, this is about the people. And the government of Kerala should be very, very cognizant, because it is more power to the people there than anywhere else. That's why I am saying, and I think and that's not, they are very busy, the governor and the chief minister are fighting, that's another story. But the point is that you have to take cognizance that something is happening in your backyard. Dr. Nuhu, I want to ask you this. Of course, comparisons are odious. So I am going to only focus right now on the subvariant. It is said JN.1 is a severely immune evasive and fast spreading variant, and it is very different from all the prior versions of the virus. This enables it to infect people who had previous COVID infections and also people who were vaccinated. So, see, no one is safe here. You know, we are all vulnerable. So, when it says that it's even not only is it spreading fast, Dr. Nuhu, it is also immune evasive. Please explain this for the benefit of the viewers. What does that mean?
Yeah. Yeah, yes. This new subvariant has a high infectivity. That is true. It can if one group of one person in a group is infected, the chances of getting that infection to all others, it's very high. But at the same time, the symptoms or maybe the clinical manifestations are almost always very mild only. There is nothing of nothing to worry. It is not affecting the cardiac system or maybe the central nervous system and other systems. As we view, as we see these cases, we can see that the majority of the cases, even though infectivity is high, we have mild cases. Regarding the immunity thing, we have a hybrid immunity. We almost all must have got COVID-19 at some point of time. So we have taken the injections also, the vaccine also. Both of these give a hybrid immunity, which definitely decreases the impact of the illness, and the clinical manifestations will be milder. There is no immune evasion means, it doesn't mean that whenever there is a probability, whenever you are in close contact with someone else, you are definitely going to get infection and it will be severe. It is not like that. Immune evasion means definitely it is not giving 100% protection, but definitely the vaccine is giving a partial protection. Previous infection is also giving a partial protection, so the infection will be milder. That is the thing which is happening regarding this new variant, and this has happened in many parts of the world also, even with the same variant.
Professor Jayalal, if this is something like Dr. Nuhu says, that it does, it spreads very fast, okay? But of course, if you've been vaccinated earlier, it will protect you partially. It will also protect you if you've had COVID earlier. But the thing is that the one category which is highly vulnerable in any kind of a subvariant is the one who's elderly and who has comorbidities. And you as doctors know very well that now comorbidities are not just for old people. 30-year-olds are having diabetes now. There is gestational diabetes across. I've seen children, 25-year-old boys having it. So the thing is that there are comorbidities here. So when the risk is so high, it spreads fast, comorbidities particularly, and if you are elderly, whether even if you are young and if you have comorbidities, why aren't the restrictions in place? Why can't people in Kerala mask up? What is the difficulty in masking up is my question. Because if you've been an example, why is Karnataka taking precautions, Dr. Jayalal? Because the state, shares a border with you. It shares a border. There's a porous border. So therefore, we are all one nation, but we have to be careful, no? So I'm saying for you doctors also to say, okay, it's very mild. But the thing is, then you say, oh, it's very mild, but you died because you were old and you had a comorbidity. I don't understand this. It's very scary. I'll be the first one to die.
Absolutely, I agree on this conundrum. On one hand, we say it is fastly spreading, and that is true also. What we saw in Singapore, the doubling of the peak reached in 13 days. But the old COVID situation in our country, in the previous first wave, second wave, third wave, it took nearly 40 days to 45 days to reach the peak. But in Singapore, we saw the peak just happening within 12 to 13 days. And good thing is it is also now coming down. But similarly, so we know that transmissibility is high. But one of the good things which is happening in India is our hybrid immunity, as said by Nuhu, that is the T-cell immunity is good. But I fully agree on your point that knowing very well that it is spreading fast and knowing very well and it has an evasion capacity, it is better on our part to see that wear the mask and adequately follow the COVID protocol. I will not say that the government is not instructing, because what I see from the newspapers and the news which we are getting from Kerala, it is advised, the people are getting advised, the people are now saying that do not get panic, but it is prudent on your part to wear the mask, prudent on your part to wear the adequate follow-up of the etiquette. And in fact, in the hospitals, they are advising, in the hospital, the people who are working, because they are the high burden areas of the COVID, to wear the mask. That is a mandatory requirement is given for the hospital staff. So on that level, the government is only taking steps by step procedure. And it is not saying that you should not wear, it is only advising the people to wear the mask. Maybe the restriction part, when we talk about the restriction, as you compare like what you have in Karnataka, if the government is not coming forward, probably it is a highly sensitive state with this festive season, both on the Sabarimala and both on the Christmas New Year festival. These two are the part and parcel of the life of the people of Kerala, and they have more affinity towards that. At this point, putting some restrictions is definitely, it will be a counterproductive. But I am confident, both Indian Medical Association of the Kerala state, including Dr. Sulfi, we are advising all our people who are coming, to the mass gatherings to wear the mask and follow the COVID protocol. I fully agree with you. It is the responsibility of us as a doctors to prevent this, and we cannot say that because of your comorbidity you are dying. We will take all our precaution to see that we are following, not as an example, and also show to the people that you need to follow to prevent the complications of the COVID.
Very well, sir. And I'm coming back to Dr. Nuhu in a bit. Ladies and gentlemen, I'm taking yet another break. After that, Dr. Sulfi Nuhu on why Kerala is as yet not really putting restrictions on the people. Don't go away. Stay with us. I shall be back.
Since the last 2 years, Khalistani terror groups are threatening Indian diplomats in Canada, US, UK and Australia. Investigations of these threats led us to the first ever abduction and killing of an Indian diplomat, Ravindra Matre, in UK's Birmingham in 1984. Our months-long investigation finally led us to the murderer of Ravindra Matre, who has been hiding in Pakistan-occupied Kashmir for the last 40 years. Watch our exclusive documentary, Murder of an Indian Diplomat, where we reveal the man who killed Ravindra Matre.
Stop searching, start streaming. Download the world's first news OTT, News9 Plus, ahead of the curve.
Pakistani spy agency ISI's sinister plan to target India. Training women to honey trap top civil and military officials. Counter honey trapping ops initiated by India. But gullible victims still caught in the web. Top military intelligence experts break down the web of deception. Colonel Hani Bakshi explains the phenomena of honey trap.
जहाँ पे भी आपको लगेगा, उनको लगेगा कि there is a person who is susceptible to women, who's making a lot of women friends on the social media. That is where they will make a spoof account and then start luring the person.
Colonel Pavitran Rajan decodes the psyche of the victim and the predator.
But when you go up the chain, no one enforces it to people at the top. That disciplinary regime and the security regime is not enforced at the top. And they usually have a public profile where it is much more easier to approach that person.
A News9 special on how modern technology has added teeth to the ancient spying tactic.
Our story takes you inside Pakistan's honey trap machine.
This and more, streaming on world's first news OTT, News9 Plus. Download now.
Welcome back. We're talking about how despite 88% of the country's COVID cases in Kerala, the Kerala government is yet not really imposing any kind of restrictions on the people. There is no mandatory masking up, whereas Karnataka has already started. for the elderly and those with comorbidities, and also there is checking of temperature in Karnataka schools. But Kerala seems to be footloose and completely free of all these burdens as of now, and we are discussing why. Some say, and this is an allegation, it's because of the Pinarayi-led government's mass outreach program, and that ends on Saturday, and once that's over, maybe the state will see some kind of a restriction. I am being joined by experts here. One of them happens to be Professor Dr. J. A. Jayalal, who is former National President of IMA, who spoke about how prevention is indeed better than cure, but then maybe the time has not arrived as yet. Professor Jayalal, when you first spoke about, how the numbers are huge, like 88% of the cases are in Kerala. I've been getting a lot of queries on WhatsApp that if the numbers are huge, when is it that the government actually decides that, you should now actually, go for restrictions? What is the time when that happens?
Can you just repeat? I mean, I've not.
No problem, doctor. I said that what is the time, what is the situation when the state, any state, decides that it is time for restrictions? Because the numbers are high.
Now, absolutely, now we are at the right time, and this is, even I will say this is a bit late. And now this is mandatory at this moment. The government should take a decision and announce that the restrictions are mandatory. Because, as you said, what we are seeing in front of us and what we are seeing, extrapolating what is happening with the Singapore, I think this is appropriate that we should be able to make mandatory restrictions on wearing the mask and following the COVID protocol. Because the doubling time here, now today the case number is 265 positive. That means 30% of the testing is becoming positive. That is a good tool to say that this is the time the government should take measure. And also knowing ahead, the government knows that very well there is a lot of festive seasons and a lot of activities are going to take place in the government. A lot of people are coming in and going out. For the Sabrimala,
yes.
It's not only the people Kerala are going. It's a lot of people from other states are going to come. And a lot of people from Western countries are also coming in.
Yes.
So this is the right time. I think the government should not now delay in announcing mandatory provisions to control the possibility of spreading the COVID.
Yeah, because the increase that you spoke about, doctor, it's almost 200 cases which increased. Now see, Kerala, it's also written that the elderly woman who was infected, they thought it was influenza. It was only testing which helped. It was only after testing they found, because isn't it right that the symptoms of this is again very much like a common influenza thing? Fever, cough, mild fever, headache, some kind of discomfort. Those, isn't it very common, the symptoms which are there, with influenza? So therefore it's risky. So Kerala went ahead and tested it. So when it could take the precaution in stage 1, don't you think it can take a further precaution by putting restrictions in place?
Absolutely, you are right, because now these symptoms are cocktail symptoms, and which is very difficult clinically to differentiate whether it is influenza, whether it is a COVID, or whether it is a common cold, and it is quite difficult neither for the patient nor for even a doctor to differentiate this. But the only possible way out of it is as a testing. Kerala is doing very well on that. Then they are doing a lot of testing is there. When the test results are showing as a positive rate is very high, because in November 1st, it was only 2%. In December 1st, it was only 5%. And December 18, it shows 30% of the sample tested are positive. That means it is a rapid spread of the disease is there. And we all know also the virus, the Omicron virus, as the transmissibility time is very high. The R factor is more for this virus. So it is a time the government should take. But only what it is satisfying us or what we are comfortable is the people of Kerala. The people are more educated. They are health conscious people. They are aware of things happening outside the society. Self-control and this very much happening. When we are moving around in Kerala, we are able to see the people are coming with a lot of people moving around with the mask. Hospitals are already started masking. So that is a good step. Even though the government has not mandatorily announced, The people are themselves are following this. But
All
if the
right.
government can announce mandatorily, it will be very good. And we appreciate that if it is the government. We expect the
right.
government to come out and open.
Dr. Nuhu is back with us. Dr. Nuhu, I want to ask you quickly if you can tell me that even if it's a very mild infection and a lot of people are getting cured by home isolation, that's what I've been reading. But the point is that if you look at the numbers, like just now Professor Jayalal was explaining, don't you think the time is right maybe to put basic restrictions in place, or you think even that can be delayed in Kerala?
Yeah, what happens is that we have given advice to wear mask inside the hospital, and also insisted that all health workers must wear mask. And then also we have asked the people, only especially the people with comorbidities, they have to wear they have to have a social distancing and wear mask when there is clinical features of respiratory tract infection. I think that restriction itself is enough at the moment. And we have not yet reached the peak. Maybe the peak will come in another 2 to 3 days, or maybe within a week or so, and then it will come down. That is the general perception, general consensus we have at the moment. So that restriction, if we can follow strictly, that is first thing: wear mask when there is a respiratory tract infection, wear mask when you are going to hospitals, even without a respiratory infection, or maybe for some other reason. And also the health workers must wear mask when they are examining patients and dealing with the patients needed. Yeah.
All right. So let's wait. Maybe, after Christmas, Kerala government will go for it and also prove that it has been number one when it comes to putting a lid on COVID. Merry Christmas to both of you doctors. Have a wonderful Christmas. Thank you very much for joining us on this broadcast.
Yeah, Merry Christmas and Happy New Year to you too.
Thank you too. Thank you.
Thank you.
Thank you. So, like I said, who knows? Maybe after Christmas, Kerala will decide to go in for the restriction, because I think the reason is also political. Being a journalist, I'm kind of compulsively thinking in that one direction. Our next story is coming from Tamil Nadu. It's politics over floods. Wait for it. I'll come back in a jiffy. The South Indian is back, and let me tell you, when the Tamils argue, boy, can they argue. Ask me, this South Indian is one. You know what? It has been one of the worst floods in Tamil Nadu. Going back to 1871, the southern districts of Thuthukudi, Tirunelveli, Tenkasi and Kanyakumari nearly drowned on 18th of December. Although there are no official figures about the casualties, there have been a number of deaths, including that of little children. Acres and acres of crops have been destroyed, homes have been lost, and it was like the regions were completely cut off from civilization. Dams were breached and rivers were in spate. Experts blamed it on freak weather conditions. People blamed the DMK government for almost having abandoned them. But you know what? Let's not forget the Tamil Nadu government was just about coming out of cyclone Migjom when the deluge hit the southern districts of the state. Chief Minister M.K. Stalin was in the capital on Monday to attend the India bloc meeting, and also met Prime Minister Modi on Tuesday to ask for a grant of 12,659 crores to tide over the devastation faced by his people. But what Stalin also did was blame the IMD and said how the warning was delayed, and despite which the government managed to mitigate the damage.
கடந்த 19ஆம் தேதி அன்று இரவு மாண்புமிகு பிரதமர் திரு நரேந்திர மோடி அவர்களை புதுடெல்லியிலே சந்தித்து தமிழ்நாட்டில் நிகழ்ந்துள்ள 2 பெரிய வெள்ள பாதிப்புகளுக்கு தேவைப்படும் நிதியினை தேசிய பேரிடர் நிவாரண நிதியிலிருந்து உடனடியாக வழங்கிட கோரிக்கை மனுவை அளித்துள்ளேன். இதன்படி தமிழ்நாட்டினுடைய SDRFக்கு ஒவ்வொரு ஆண்டும் ஒதுக்கப்பட்டுள்ள நிதி 1200 கோடி ரூபாய் ஆகும். ஒரு இயற்கை பேரிடரின் தாக்கம் மிக கடுமையாக இருக்கும்போது இந்த SDRF நிதி போதவில்லை என்றால் அந்த இயற்கை பேரிடரை கடும் இயற்கை பேரிடராக அறிவித்து தேசிய பேரிடர் நிவாரண நிதியிலிருந்து NDRF கூடுதல் நிதி ஒதுக்கப்படும். சென்னையில் ஏற்பட்ட பெருவெள்ளத்தையும் தற்போது தென் மாவட்டங்களில் ஏற்பட்டிருந்த வரலாறு காணாத வெள்ளத்தையும் இவ்வாறு கடும் பேரிடர்களாக அறிவித்து NDRFில் இருந்து கூடுதல் நிதி ஒதுக்கிட வேண்டும் என்றுதான் நாங்கள் பல முறை கோரிக்கை வைத்துள்ளோம்.
வானிலை ஆய்வு மையத்தின் எச்சரிக்கை நமக்கு சற்றே தாமதமாக கிடைத்தாலும் அதில் அளித்துள்ள அளவை விட அதிகமாக மழைப்பொழிவு ஏற்பட்ட சூழ்நிலையிலும் தமிழ்நாடு அரசு முன்கூட்டியே பல்வேறு முன்னெச்சரிக்கை நடவடிக்கை எடுத்திருந்தது என்பதை இங்கே நான் சுட்டிக்காட்ட விரும்புகிறேன்.
That's what Chief Minister Stalin said. On Friday, Union Finance Minister Nirmala Sitharaman trained her guns on Muka Stalin and said that the regional meteorological center, Chennai, has ultra-modern equipment, including 3 Dopplers, and had forecast on 12 December itself that there would be heavy rainfall in 4 districts, that is Tenkasi, Kanyakumari, Tirunelveli and Thoothukudi on 17th of December. Nirmala therefore demolished Stalin's allegations.
என்னெல்லாம் விதமான உதவிகள் மத்திய அரசு உடனடியாக கொடுத்துருக்குன்றத நான் அன்னைக்கும் அந்த ப்ரெஸ்ஸில் அந்த ட்விட்டர் மூலமாகவும் போட்டதற்கு ஹோம் மினிஸ்ட்ரி மூலமாக அது ப்ரெஸ் ரிலீஸாகவும் வந்ததுனால அந்த விவரத்தில் நான் இப்போது அதிகபட்சமாக பேசலை. 18ஆம் தேதியே ராத்திரிக்கு அந்த விவரம் வெளியில் வந்துடுச்சு. அதுக்கப்புறம் அங்கே போட்ஸும் போயிட்டுருக்கு, ஹெலிகாப்டர் மூலமாகவும் பண்ணிகிட்ருக்காங்க. எவ்வளோ ஹெலிகாப்டர் எவ்வளோ போட் அப்படிங்கிறத மாத்திரம் ஒரு 2-3 விவரம் கொடுக்குறேன். ஆனால் மொத்தமாக சேர்த்து 21ஆம் தேதி டிசம்பர் வரைக்கும் நம்ம கையில் இருக்கக்கூடிய செய்தி 42,290 பேர் மீட்கப்பட்டிருக்காங்க. மொத்தமாக இதில் எல்லாரும் சேர்த்து மீட்கப்பட்டது. ஸ்டேட் போலீஸு, ஸ்டேட்டில் ரிலீஃப் பண்ணுறவங்க, இராணுவ படை மூலமாக, கப்பல் படை மூலமாக, கோஸ்ட் கார்டு மூலமாக, இதெல்லாம் சேர்த்து போட்டு 42,290 பேர் மீட்கப்பட்டிருக்காங்க.
Sitharaman next said in no uncertain terms that the centre has already released 900 crores in 2 installments to be used in this financial year to Tamil Nadu. While she was speaking to the media people, almost insinuating that Stalin perhaps shouldn't have complained about the centre not having given Tamil Nadu adequate funds. But you know what? Her last statement, which by the way was also trending on X the day Stalin was in Delhi, #missing CM, was truly the most serious attack on Stalin. She said that when such a massive disaster was taking place in Tamil Nadu, Chief Minister Muka Stalin was in Delhi with the India alliance. Sarcasm much. But let me tell you something, I am saying this here now, this ain't going away. This slugfest between the centre and Tamil Nadu will continue until the 2024 Lok Sabha elections are here. Count on your fingertips. NEET, NEP, Hindi imposition, GST, and now floods. Everywhere the DMK government fights off the Narendra Modi-led government at the centre. Anyway, coming up next, News9 special documentary called The Donkey Network. Don't miss this one. Enjoy yourself. And with that note, the South Indian says, Vanakkam, take care of yourself and do make this your destination for all the stories from the south of India.